Welcome to everyone who is watching this webinar. Thank you so much for joining us tonight. We have an amazing panel, if you can't tell already, with us tonight to talk about their experiences in global surgery and specifically within general surgery residency for those of you who are interested in applying or will be applying in like less than a month. So we hope that they're able to answer some of your questions and how to best select programs, factor it into residency selection, and also during residency thinking about how you can participate in global surgery in a slew of different ways, which is really awesome. So with us tonight, we have Dr. Youmna Sherif, who is a resident in the global surgery track at the Baylor College of Medicine. Her interests include global surgery education, ethics of global surgery, surgical capacity building, and surgical infrastructure. In pursuit of these interests, she has engaged in global surgery work in Egypt, Malawi, Turkey, and Uganda. And she has worked with community partners in these nations and performed research on the structure of global surgery education in high-income countries, the professional development of non-physician clinicians in sub-Saharan Africa, global surgery scale-up models, the use of guidelines and surgical standards in low and middle-income countries, humanism in medicine, and Islamic bioethics as it relates to the care of the female. We also have Dr. Rashi Jhunjhunwala with us today. She is a general surgery resident at Beth Israel Deaconess Medical Center in Boston, where she has completed her 3rd year of residency and is in the 1st year of her 2-year research sabbatical. She attended medical school at Emory, where her interest in global surgery was piqued, and then completed a master's in bioethics and society at King's College London. She's currently a research fellow at the program in global surgery and social change at Harvard Medical School. You'll notice also a strong ethics component to all of these women, which is awesome. We also have Dr. Nicole Starr with us. She's a general surgery resident at UCSF and graduated from Boston University School of Medicine in 2015. Her area of interest are in academic global surgery, surgical quality improvement, and infection prevention, and strengthening trauma care systems in resource-limited environments, as well as trauma-induced coagulopathy and platelet function in injured patients. Dr. Starr served in the Peace Corps in Ethiopia from 2007 to 2009, and has been working in Ethiopia since 2018. As a LifeVox Senior Surgical Fellow. She's worked in Ethiopia, Brazil, and Liberia on health services research, surgical quality improvement, and more remotely, improving care for TB and HIV/AIDS. She recently also just had a paper release, so definitely check that out. And last but not least, we have Dr. Alyssa Brandt with us. She first became involved with global health as an undergraduate student doing research at a hospital in Ghana, and attended Penn State College of Medicine, where she was a global health scholar and continued to do research at Eastern Regional Hospital in Ghana, as well as in Zambia. She's now a 2nd-year general surgery resident at the University of Utah, where she plans to continue her global surgery work during her research time. And she's also one of our Board of Trustees members for GSSA. She was one of our former VPs of education. So it's awesome to have her back on our panel to continue to shed some light on global surgery and her journey in there. So thank you all for being with us today. Also, if anyone has any questions, feel free to put them in the Q&A. We do have a selection of questions that you put in the registration form that we'll be going over in the second half of the webinar. So what I'd like to do to just start off is give each of you a little bit of time to speak about your background, what you're doing now, and kind of any interest that you have in global surgery specifically, and perhaps why you also picked the program that you are at. So why don't we start with Rashi?
Yeah, sure. So hi, everybody. I'm Rashi. I'm at Beth Israel, which is in Boston. I am, as Anusha just said, I finished my 3rd year and I'm very excited to be in my research time. It is way more relaxed in some ways than being in residency, but it's like also very different and has its own stressors, and there's like deadlines that don't go away just because it's like after the time that you're at work, and you could like wake up at 2 a.m. and work on things too if you wanted to, which is its own kind of stress. So yeah, so I'm at the program in global surgery and in social change at Harvard, and the reason that I chose to come to Beth Israel is actually because I was really interested in doing this program for my research time. So I guess the starting point of it is that I never thought I was going to be a doctor. I thought I was going to do like international diplomacy, and like I was an IR major in college, and then I actually really liked science, and I was like, ugh, I guess I have to be a doctor. I don't know. So I've always kind of wanted to get that international component back into medicine, and that was always a thing that I wanted to do. And so I did global health, like mission trips in Haiti in med school, and really hated it, as I'm sure many people also who are interested in doing global surgery as a real career might, because it just is not sustainable, and all the problems that we all kind of face with mission trips. And that drove me to really wanting to be intentional about the program that I did for residency, so that I could really be deliberate and could create sustainable change in whatever method I could. So because of all that, that led me to do my master's in bioethics, where I focused on global health ethics and global surgery ethics specifically. And I did that in like 2015, 2016. So it was right when the Lancet Commission was coming out, and I was writing all these things, including the Lancet Commission. And so then when I was doing residency interviews, I did specifically focus on some of the Boston area hospitals, with the eye of being able to collaborate with people at GSSA, which is what we call the Program in Global Surgery and Social Change, and learn more about it and see if that's the program that I wanted to be involved with. And I just so happened that on my pre-interview dinner night at Beth Israel, I happened to start chatting to one of he was a PGY, he was a PGY4 at the time, that he was a chief when I was a intern, Nicole Rakar, who's now actually back as a faculty member at the Brigham, so and working with PGSSC. And I just started chatting to him that night, and he was telling me about how he helped develop the bellwether procedures, and I was like, okay, cool. So that is kind of the long story of how I ended up at this program, because I thought it was really interesting that they had a direct line to the PGSSC and a lot of history with that program. And I did a little bit of research into other programs. I mean, the Baylor program sounds awesome, so excited to hear more about that. And Utah too, they didn't interview me, sorry. But yeah, no, things like, there's so many different cool programs, but that was kind of where my journey led.
Awesome. Thank you for sharing that with us. And I'm definitely feeling the deadlines don't go away, especially now that everyone's on Zoom. And I'm sure everyone knows with global health research in general, you have to work across those time zones. So no matter what hour it is, there's a chance you might have a meeting. So thanks for sharing with us. Youmna, do you want to go next?
Yeah, absolutely. So I've been involved with global health work since I've been in college. I worked for an NGO after my freshman year of college in Turkey. I then worked and designed my own project in Egypt, where my family is originally from, for also another few months, and I'd followed up with it kind of over time. I actually was pretty adamant that I wasn't going to be a surgeon when I entered medical school. And so I was president of the geriatric student interest group, was going on internal medicine all the way. Did my general surgery rotation, I think May of my third year. And I was like, oh no, I think I found my people. And so after that, it kind of just we went from there, talked to my program director, tried to find what would be a good fit for me. Initially, I actually wasn't really focused on the global surgery elements of training. All of my advisors at the time said, it's important for you to focus on just becoming a good general surgeon. And while I appreciate that advice, I now in retrospect feel like it was important to continue what I was passionate about even throughout my residency, despite the fact that, again, we do have a lot of time that we put into our clinical work. So I ended up matching at Baylor. I think I ended up at the global surgery program partly because Dr. Davis, who is the initial global surgery resident at Baylor, we had a conversation kind of about the ethics of long-term versus short-term trips, and how it was important for us to focus on capacity building and surgical infrastructure personally as individuals engaged in global surgery. And I think after that, we knew we were a good match for each other. And so I ended up at Baylor. I finished 2 years of my general surgery residency, and then did 1 year of global surgery clinical work and research. And now I'm back into my third year of general surgery residency. The way that the Baylor program is structured is we do 2 years gen surg, 1 year global surgery, 3 years gen surg, and a seventh year of global surgery. The purpose of that is that we'll be board certified surgeons by the time we leave for our last global surgery year. So we can do both meaningful clinical and capacity building work while we're abroad.
That sounds great. Could you also, I know that the program has also talked about having some orthopedics and OBGYN training factored into that. Could you speak a little bit more about that?
So part of one of my passions is like global surgery education in general. And looking into this, they have structured different global surgery models to accomplish different things. I think ours was structured right around the time that the 44 essential surgeries were developed. So Rachel came up with the curriculum having these core rotations prior to, Dr. Davis, prior to the development of the 44 essential surgeries. And so it was fantastic because they actually mirrored the 44 essential surgeries. So for our first year, we're all required to take certain core rotations that assist us with the familiarity and the technical performance of the World Bank's 44 essential surgeries, which are a set of surgeries that are deemed cost effective to be performed in resource limited settings and that have that can effectively reduce the worldwide disease burden and like assist in like the quality of life in resource limited settings. So for that, we found that if we include urology rotations, orthopedic surgery rotations, OBGYN rotations, burn, and then just to the assistance of identification of pathology and for a more complete understanding of like care of the patient in urgent settings, we also do an anesthesia rotation and we do an ultrasound rotation, which has been, I have to say, very nice when you go into resource limited settings, partly because if you look at kind of the breakdown of surgical cases in resource limited settings, they tend to sway towards, again, these different surgical procedures that are part of the list of the 44 essential surgeries. So I think last I checked, C-sections were like 50% of the cases that were performed by the MSF folks abroad. And so, yeah, other than that, that first year, we're free to structure the way that we like it, whether it's clinical work, surgical capacity building work, or research. And then our last year or seventh year, you can revisit any of the core rotations. So if you feel like you didn't quite get how to do a C-section the first time around, you can have another month of OBGYN, or you can do it at one of our partner institutions abroad in like Malawi. Similarly, like if you feel like you just weren't good at setting fractures, which it took me a while, you can do another rotation with our orthopedics team, which is great because like it's a very heavy like trauma team, and so it's really easy to get familiar with fractures really quickly. Yeah, and then you essentially your interests that you developed in your first year, you get to expand upon them for longer term projects in your final year, hopefully to set you up for what your clinical practice will look like as a global surgeon with appropriate mentorship and guidance for your first year.
Thank you so much for expanding on that. It sounds like a really interesting kind of way to integrate everything that you might see no matter where you go. So Nicole, do you want to speak about your background and your program?
Sure. Thank you for having me on, and it's fascinating to learn more about your own programs as well. So I'm really learning a lot from this panel, maybe as much as the applicants are. So I'm Nicole. I'm a 6th year general surgery resident at UCSF. So I've done 3 years of clinical, and I'm now in my 3rd year of research. I got my start in global health. I mean, some of it you sort of heard from the bio that Anusha read, but initially I was a Peace Corps volunteer in Ethiopia. That was right after I had done my MPH like a gajillion years ago. And I lived in Ethiopia in a
semi-urban area for 2 years, working on monitoring evaluation of HIV/AIDS programs that were in my region. So that sort of set the kind of, I don't know, framework that I had for global health work. I was, you know, very much integrated into my community, working on the ground, seeing things from sort of a maybe flipped perspective than we might typically get as sort of an intro to global health from a place like the United States. So it was very formative for me, and I'm grateful for that. And it sort of, you know, solidified the notion that I wanted to work in global health as part of my medical career. But similarly to what Youmna said, I had zero thought of being a surgeon when I started medical school. I was sort of anticipating a career in infectious disease or emergency medicine, something that seemed sort of traditionally more accessible for a global health career. And intentionally chose surgery as my first rotation of my third year because I thought it would be awful, and immediately found my people, and I was like, ah, crap, okay, I have to figure out how this is gonna work. Luckily, that was in 2014. So, I mean, I had huge doubts around how global surgery could really be a tenable career. And I think the community was sort of growing. That was the year the Lancet Commission was underway. And so even sort of the sea change in the last 5 years is sort of incredible, that now this is very much a career you can have. There's no doubt about that. But at that time, and I was young and inexperienced, so I didn't know if there was a way to make it work. So I ended up going back to Ethiopia in my fourth year of medical school, spending a couple months there doing some work on sort of measuring access to surgery, and also got to be involved in a bit of the Lancet Commission work. And that, you know, sort of let me know that there was space for clinicians in that world, and it's a field that's growing and changing very quickly, and that was very exciting. So then I went on to UCSF, and for my research time after my third clinical year, went back to Ethiopia, where I've lived for the last 2 years, working with an NGO called Lifebox, mostly around surgical quality improvements and infection prevention. That's really where a lot of my interests lie in global surgery work. You know, it's a wide field, and there's space for everyone, and there needs to be space for everyone in terms of guidelines, policy, tools, etc. My passion personally is around implementation and quality improvement, finding a way for sort of the rubber to meet the road, and making sure that the effects we would anticipate from doing particular trainings or putting out guidelines and stuff are actually achieved at the end user level. So I've been doing that, and then my clinical interest is in trauma surgery. So I've taken this third year to do a Fogarty Fellowship, and still focusing on quality improvement, but more in the trauma realm. So we're working with the Ministry of Health and the World Health Organization to try and implement some trauma quality improvement programs at a few of the bigger hospitals in Addis. So why did I choose UCSF? I mean, I think there's a lot that goes into your selection of a residency program. And I guess if I could have one sort of takeaway, it's that I'm not sure the program necessarily has to dictate completely or matters so much in terms of your global surgery experience. My mentors actually ended up being mostly not from UCSF, even though I chose that program in part because they had a global surgery center and some clinical mentors that I really admired. It just happened to work out that a lot of my mentors are from Stanford and Edinburgh and Ethiopia and various other places. So I think you can make it work no matter where you end up. I was sort of taking into account the big picture of what I wanted from a program overall. So for me, it was really important to have sort of a safety net hospital that saw vulnerable populations in my own community, that had a strong trauma system and trauma experience, because that was my clinical sort of interest, that had a wide variety of experiences. So at UCSF, we have like a quaternary referral hospital, we have experiences in community hospitals, in the private setting, and at San Francisco General, which is our sort of county hospital. So having sort of a broad experience like that during my clinical training was important. And then having the flexibility to have a global surgery experience was also important. So those were sort of the factors that I weighed. I think there's a million ways to do it. And as we've heard already, you know, you guys have really interesting and different paths. So that was just my experience so far.
That's awesome to hear. I think that a common theme we often see is people thinking they're not going to pursue one specialty and then pursuing a specialty, and something we've seen through multiple of the panels. One of the anesthesiologists on the anesthesiology panel actually did an entire surgical intern year and applied into general surgery, and then realized she wanted to do anesthesia. So I think a lot of medical students especially struggle trying to figure out what they're trying to do even late into their third year. And I think knowing that a lot of people go through that like is reassuring, and that you still figure out what you want to do and enjoy it, and that there's time to change. I think sometimes, you know, we feel like we're stuck in these tracks and that's all we can do. So definitely appreciate hearing that. And then last but definitely not least, Alyssa, do you want to tell us a little bit about Utah and your path there?
Yeah, so I'm one of the more junior residents on the panel, so I'll probably have less to say about global surgery as a resident because I just finished my intern year, and your intern year is nothing but intern year. But I I got involved in global surgery kind of to echo what other people said, just through mission trips, and kind of was really frustrated with just the infrastructure of the mission trip, quote unquote. And so I started getting involved in more global surgery infrastructure and research as a medical student. I spent some time in Ghana as a medical student and befriended a surgeon there in Koforidua with Ghana, and worked with him. I actually did a 4th year sub-I with him, a global surgery sub-I, and I did 150 cases in a month with him. And we didn't sleep, and we ate sometimes, and it was a blast. And he taught me a lot about what it's like to do research there and what it's like to practice. And I did some research in Zambia when I was in medical school, studying the different interventions that had been made on children who had been orphaned because of HIV and AIDS in the pandemic in rural Zambia, and what sorts of things influenced the long-term outcomes socially for these kids, what influenced whether or not they stayed in school or stayed with their families, or were adopted by family versus sent to orphanages and things like that. And then I did some basic science research in malaria in medical school. I worked with a physician who had been awarded the Gates grant for this crazy idea where you could have everybody walk through a type of X-ray scanner, and actually the theory behind it was that there's a higher concentration of iron within an individual malaria parasite, and theoretically if you could heat that up more than the rest, it would extinguish malaria. And so if you could put these in airports, for example, you could screen people out of it. It was wild. But so he's still working on that, I think. But I kind of worked in his lab on that project and some sub-projects with malaria, which was a lot of fun. And then once I graduated, started looking for, well, I guess before I graduated, started looking for global surgery programs, and the GSSA had a lot to do with that. I worked hard on a sort of a handbook there, and a lot of the handbook comments on how to create a global surgery rotation and how to look for residency and what different types of global surgery opportunities are out there. And so I really want to echo what has been said before, in that global surgery and residency in and of itself is a lot more free form than it was in medical school. And you can oftentimes make opportunities that you want for yourself as long as you can have a compelling argument. And so what I would say is what I looked for in a residency first was somewhere where I would be able to have that freedom. And that was most places. And then I looked for somewhere that was going to make me a really stinking good general surgeon. And so the University of Utah, I finished my first 2 years worth of cases in 7 months of intern year. We operate so much. We do a general surgery rotation here at a community hospital. We get 200 cases in 2 months. And it's unheard of. I, as a metric, everywhere I interviewed, I asked every resident, at what year could you do a lap chole front to back comfortably, a simple one, not like a really gnarly one, but just a straightforward lap chole. And everywhere said around year 3, and I came to University of Utah, and I asked an intern, and she was like, you know, I could probably do one now. And I didn't believe her, so I asked another intern, same answer. And sure enough, by the end of intern year, I kicked my attending out of the operating room and did a lap chole front to back. So I think it really depends on what you're looking for in a residency. I've found often residencies had an emphasis on certain specialties. So for example, I'd go somewhere and people who are really interested in surg-onc really like this place, and people who are really interested in trauma really like this place. And so that was one metric. And then really like how much people operated was another one. And then Utah is a lifestyle thing also. My husky and I spent a lot of time summiting mountains out here and skiing and stuff. So that's kind of how I ended up here.
Awesome. Thank you so much. I'm going to quickly change the view for everyone to gallery view so you can see all the speakers now that everyone's kind of had a moment to speak their part. And you've covered actually a number of the questions I was going to ask you, but I think just to break it down a little bit more for some of the maybe like more junior medical students who are asking, or thinking about how research really looks within general surgery, because I know research time off varies from specialty to specialty program. So Rashi, could you kind of quickly tell us like what does an academic program look like in terms of like how many clinical years and research years, clinical years?
Yeah, sure. So I think as if with everything, it depends. But in general, so general surgery is 5 clinical years. That's like ACGME mandated 5 years. And then depending on what your program requirements are, you can either do no research, you can do 1 year, you can do 2 years, you can do more than that. You can do a PhD, you can like whatever. So it can be very flexible. There are some programs that I found when I was interviewing that were quite rigid in what they wanted their applicants or the residents to do. At BI, we are very individualized, I would say. It's good in most ways, it's really good, but sometimes it means that like so for this last year, we have 9 clinical residents, a categorical residency year, and only 2 of the PGY2s went on to become PGY3s. Like 7 people went out to research after PGY2, because we can choose whether we want to go out after our 2nd or our 3rd year. And there are reasons for the more junior people on the call, like there are reasons why you might want to do one versus the other, and that's generally specialty dependent. Yeah, so like a lot of people in that class want to do pediatric surgery, and so they all went out after 2nd year so that they could get more like lab time in and more time to publish. And in my class, we were pretty balanced, and then some classes like more people go after 3rd year, and we don't have like a limit of how many people, obviously, because 7 people went out of that 1 year, but it makes it kind of more challenging on the back end when people are coming back after research, trying to fit in how many people we have in per class. And so it's definitely possible to do more than 2 years, but I think the standard like research time for most academic programs is about 2 years.
Yeah, and Alyssa, can you talk a little bit about Utah's, because I know they have a varying program where you guys could be taking 1 year, 2 years, maybe even no years, right?
Yeah, so this seems like it may be in flux, but I think for the next couple years it will stay in place for the reason that was just said, that it's really hard to keep class sizes the same, because if you have random people leaving for X number of years, you don't want to have a class of 10 and then a class of 5. So what they do at Utah is during your 3rd year, or I guess at the end of your 2nd year, you submit a research proposal. You say, here's what I want to do with my research years. And if you have your own funding and stuff, then you get whatever you want, basically, because then they don't have to pay for you. But you submit a proposal and you say, here's the research I want to do, here's how many years I want to do it. So for example, I'm trying to decide between peds and trauma right now, and so I'm preparing like I'm going into peds. I'm like, I need 2 years, and here's the research I'm doing with this advisor on my proposal. Here's why I need 2 years, and here's what I'm going to do with it. And I think it's like 2 people get 2 years, 3 people do 1 year, and then 1 person goes straight through. And most people get exactly what they want. Every once in a while, if somebody doesn't have their research super well set up or doesn't have a compelling reason for 2 years, they may get bumped to 1. And so that's something to think about. If you're like, no matter what, the most important thing for me is to have 2 years of research, then I would maybe err on the side of caution here. But I actually really like it. It gives you some flexibility. You're not, if I had gone to Penn State, my medical school, for example, I would have started as an intern. And even if I decided I didn't want it, I would have had to do 2 years. So it gives some flexibility, which is nice, but it also is a little risky in that you may end up not getting the years you want. There's a question in the chat I don't know the answer to, maybe somebody does, from Manasi. It says, I'm from Toronto, Canada. Do you know if research is mandatory here? And I do not know if research is mandatory in Canada.
I'm not too sure either. I would probably recommend reaching out to one of the Canadian med students. If you want to be connected with someone in Canada, I'm happy to do so if you email the email that emailed you the link. I said the word email multiple times. And we can try and connect you with some students interested in global surgery in Canada. Thank you for explaining that program. I guess like that's the nice part of it, is that there's a lot of flexibility in how you go about choosing a general surgery program, whether or not you want to be in a more community setting, a more academic setting, something in between. A lot of you have touched upon kind of like choosing a specialty and those considerations. So, and we also touched upon a little bit about, you know, how much we consider global surgery when we're choosing a residency. So if you actually didn't get a chance to speak about like, what are the considerations that went into, I guess, like your rank list essentially, right? Or choosing where to apply ultimately. I've heard a lot of people talk about, you know, you want to go somewhere that's going to make you a really great surgeon and clinician. But in terms of like actual weight, like how much did you give to the clinical aspect of it, the global surgery aspect of it, and then also if you were thinking about a specialty, you know, maybe like peds versus trauma versus surgeonc, I know they all require different amounts of time and potentially research and commitment to the field early on. So Nicole, do you want to take that question?
Sure. So I guess the first part in terms of selecting a residency, now in retrospect, I'd say there's a couple things that are really valuable. One is if this is, you know, truly a part of your career and your training experience that you want, your program needs to be flexible to allow that. They don't necessarily need to offer that, have the exact mentor there that you want to work with, but they need to be open to you having that experience and at least being able to create it for yourself. There are some, you know, for example, the PGSSC is open to people outside of the Harvard system as well. So there's a lot of trainees who are at other programs who may have sort of less opportunities in global surgery, or just that wasn't a good fit for them, who end up at PGSSC. So there's definitely opportunities for that. Similarly, my program at Lifebox, we have fellows from, you know, UCSF, Emory, also internationally. So there's definitely opportunity to sort of cross-pollinate when that research time comes. But if you have a program that's like, no, we don't think this is important, and you won't be allowed to sort of choose your own path, then that could be a deal breaker. It factored pretty heavily into my rank list in the sense that I felt it was important to be at a program that valued global surgery and had mentors there that I could look up to. And I'm still, you know, happy that was the case and that I ended up where I did. But in retrospect, I'm not sure that was the most important aspect. I think probably your clinical training and the experience that you'll have while you're in that program in your clinical years is, you know, maybe deserves more weight than the research experience, which you could get in a lot of different places. Yeah. Was there something else that I didn't address?
I think you covered most of it. It's a complicated question, I think, to think about, you know, when you're waiting and all of these different things. Was there anything in terms of like specialty choice? Because I know that if you're really interested in like pediatric surgery, for example, people are kind of thinking like years and years ahead with that because of the competitiveness of that fellowship. And I know some people will look at where have previous residents matched in terms of fellowship as an indicator of whether a program matches folks to fellowships that they're interested in.
Yeah. That's really important, actually, because the world of surgery is small, and interconnectedness and having the right type of mentors for your specialty choice is very important, I think, in matching to a fellowship that you want. A lot of people, just like we were saying, you know, we all changed our minds and decided to be surgeons halfway through med school. A lot of people go through multiple iterations of choosing a subspecialty as well. So unless you know, kind of know in your heart of hearts that you definitely want to do pediatrics or surgeonc or whatever, it's hard to kind of predict that before you've even started residency. But it is important to have the right mentorship structure to sort of set you up, make the introductions, make those phone calls and whatnot when the time comes for fellowship. Yeah.
I'll just jump in quickly on that because so everything Nicole said is like exactly right. That like it is actually pretty important to have those like specialty mentors. I would say more so than global surgery mentors, because if you know, if like as long as there's flexibility in the program, is exactly what Nicole said. Like if there's flexibility in the program and you're dedicated to global surgery by the time your research time rolls around, like you can make that happen. Like we can figure that out. But just from a specialty perspective, so I actually did have it in the back of my mind that I was going to do surgery going into med school, or not even like just after my first few years, I was like, okay, this is probably going to be it. I tried really hard not to, but I was like trying to plug for EM, but it didn't work. But so, and I kind of knew that I like trauma. So, and I was the person that the med students like love trauma, and then they'll be like, oh, you'll grow out of that. And here I am still probably going to apply to trauma. So, so Beth Israel and Boston in general does not have a lot of trauma. And I came from Emory, which has Grady Hospital, which is like it is trauma. So it was something that I was a little bit worried about coming to BI. And I will say that different to PEDS, which PEDS, I think you do have to see that track record from your program, because PEDS is just very hard to match into as a concept. So you do want to see that like fellowship match rate when you're looking at programs. But for trauma and like other more general kind of things, you just want to be a good surgeon and you're going to do the fellowship. So at Emory, like, you know, there are Emory graduates who go straight into a trauma job because they've done the fellowship during their residency. I am not going to do that at BI. Like we don't get that volume. And so I will definitely do a trauma fellowship, but that's kind of the difference there, is that you just, you know, I feel like I'm going to know how to operate pretty dang well at the end of this. And I just need to get that additional trauma training. And so that's where that falls in, is that you might just have to do a fellowship that you might not, but that's like more for trauma and like MIS and those kinds of things. Whereas for pediatrics or surg onc, where you're definitely gonna have to do a fellowship, I would say look at the fellowship match rates and like, you know, just make sure, because most programs will show you where they're like most recent, like where their recent graduates have matched or what they're doing in practice or whatever. And like, then you can see like, you're like, oh, okay, well, maybe I want to just go into private practice or community practice after residency, and just see if like many of their fellows or their residents have done that. And if everybody's doing a fellowship, then that gives you kind of the vibe of what the training program is like in that regard.
Got it.
Really quick, the Q&A, I've been typing answers to questions, and then once I do, it shoots them to it shoots them to the answered tab. And so other residents should totally hop over there and also answer questions, so I'm not the only one. But I just didn't want them to not see them because I moved them over. Also, the most important thing when I was choosing a residency was how well I got along with the residents, because you're going to spend your entire 7 years with them. And so if you think we could be friends, check out Utah. But no, but in all seriousness, so I did like 5 sub-Is, and I did a sub-I somewhere that will remain nameless, that I was like, ooh, like these are really intense people. They're not very laid back. And like, I love learning and I love academia, but I'm also pretty goofy and easygoing. And I realized like I would be a joke here. People would probably mock me for this. So find somewhere you're going to fit too. That's important.
That is a great segue into kind of my next question, which is can you give us some good questions to ask along the residency interview process that you thought really helped you get an idea of the program? And then especially, you know, anything that you asked in terms of global surgery and global health capacity. Alyssa, I loved your question on like, when were you able to do a lap chole? So that's why I thought of this. Youmna, do you want to start with this one?
Yeah, absolutely. So specifically when I was asking about global surgery, I'd always ask, you know, about the partners. Like, how long have you guys had a partnership in XYZ country? What's the nature of the work that you've been doing together? And, you know, is there an anticipated long-term project that you guys are working on currently? That information, there's been research done on this. Generally, the information available to students who are interested in global surgery isn't easily accessible online and on the websites of most general surgery programs. So it's kind of a very easy way to get into a very deep and expansive topic, and gives you a good idea for what their philosophies are on global surgery. This tells you kind of, are you anticipating more just clinical work when you get there? Are you anticipating more research work? Are you anticipating more capacity building work? Is it a mixture of all three? And depending on your opinions on each of these topics, what the ethics of that particular institution is in terms of global surgery activities and global surgery research.
Awesome. Alyssa, any other questions in terms of figuring out if it's a good personality fit?
Yeah, so I had a couple for that. Like, I would say, I would just ask the residents, like, what do you do for fun? Or like, when was the last time you hung out with another resident? What did you do? So there's a couple things you can ask just to kind of play the interview game. My favorite question I asked at every interview was, the residents who really excel here, what do they do that sets them apart from other residents? Just in case you're trying to like earn some brownie points. And then for global surgery stuff, I think the biggest thing for me is like, what sort of infrastructure, exactly like what Youmna was saying, like, is there a formal curriculum or not? That's a big one. So like some places have these great global surgery curriculums where you're in classes and learning about it. Utah has a really great global surgery fellowship, but that's sort of, and it has a lot of research support, but it doesn't have a formal curriculum. And so there's like subtle differences like that. Not every single global surgery thing is structured the same way. But yeah, as far as getting along with the residents, honestly, if you can just talk and hang out with the residents as much as you can while you're there, which is difficult because it's inherently a little awkward, but, and just sort of pick their brains about what they do and find, I find if residents all have dogs, it's a good program.
Hey, cats aren't that bad, I'll just say. My cat is cool. Run away, he's taking a nap. But the other question that I always asked was, two questions I asked of everybody I met, which is, are you happy? And you can tell when someone's lying about whether they're happy. And I would also ask, would you pick this program again? Because sometimes you don't end up where you think you would go. The match is a weird thing. But you know, the answer might change. So like, you know, it might be your 6th program that you ranked, but then you end up there and you're like, oh, this is awesome. I actually really like these people. I'm happy, I'm operating, I feel recognized, seen, well, whatever. But yeah, so those are my 2 questions that I asked in terms of like culture. Is like, are you happy and would you pick this program again? And you can tell when people are lying.
Nicole, anything else to add on to those questions?
No, I think you guys asked some really good ones. I wish I could have been on interviews with you.
Any, I guess, advice about this year with virtual interviews? Any insight, anything that your programs have talked about or other residents have talked about that you can help out folks who are applying this year for?
Our program's doing like virtual meet and greets. So they're hosting these like video chats where we all just like as many residents as we can get online and we just like chat with the applicants. You should do those, 100% do those at as many places as you can. And then really just find ways to network with the residents, I would say. One of my co-residents who's on Twitter recently said, oh, I just met an applicant on Twitter. And I was like, oh, she was also in the meet and greet. Now I know her name. I'm going to be like watching for her. So that kind of thing is really important. It's really like, for someone who's socially awkward, this was difficult, but it's really about networking and just like getting your name out there, I think, right now.
One of the, our program is doing something like that too, with like kind of just these Zoom sessions and, you know, trying to kind of like hold them at different times of the day and just have a forum for asking questions and stuff. But I think one of the hardest things this year is that like that nighttime, like the dinner before or whatever, where you can sort of have those offline conversations with residents isn't as much of a part of it. And some of the applicants so far this year have actually like been reaching out to some of us to have a one-on-one phone conversation or like a separate Zoom call, which I thought was really smart. I've spent, you know, maybe like 45 minutes on the phone with a couple of applicants who just wanted to like chat about different opportunities or kind of the vibe of the program in a way that wasn't like on Zoom in front of 30 other people. So if you guys are applying, like don't be shy to reach out to residents or faculty one-on-one, because I think they'd be super happy to talk to you. And we know this is like a weird year.
That's great to hear. So I appreciate you saying that. To kind of shift gears just a little bit, obviously all your programs are programs at which global surgery and global health is generally very well supported. While you were interviewing, or since you've interviewed, and programs have really come up in the last few years, can you name other programs that are also global health or global surgery strong in terms of like faculty and established research partnerships, things like that? Alyssa, do you want to start, because you were most recently on the interview trail?
Yeah, so Baylor, I'll shout out and then leave it to her to give it the, but Baylor, UCSF both did, Emory does, the Northeast, so like BU, Harvard, of course. Utah has a fellowship. There's a lot of places now who have fellowships, which I think is really good. I know a little more about the West Coast because my residency application was Penn State and the West Coast. And so UC Davis has a good surgery track. It's not a formal curriculum, but there's a lot of opportunity there. And the surgery program director has a lot of global surgery experience. Some of the other UCs, so I would say like UC Irvine, UCSD have a lot of funding, but they don't have a formal global surgery program. So that would be somewhere where you would be kind of independently working. Trying to think. And then most community hospitals out west didn't really have a formal infrastructure, but were pretty supportive of somebody going after it. So I would say if you're looking at West, UW definitely does. They have a formal setup and infrastructure for it. UC Davis would have like similar to Utah, where a lot of opportunity, but maybe not something as formal. And then the Northeast is really kind of your hub. It would include Emory in that. I'm not sure if you guys have anything to add to that.
I would just say also UCLA, a lot of our faculty from UCSF who are really involved in global surgery have gone to UCLA. So that's sort of becoming more robust. And then at least when I was applying, Vanderbilt was a place that sort of was known of having a lot of, giants in global surgery having gone through there. Rob Riviello trained there, and John Tarpley, who's like the godfather of
with me now. Well, he's not really with me. He's with Anusha.
I know that also, just coming out the top of my head from like faculty we've interacted with for GSSA, also VCU has some dedicated global surgery faculty going on, and one of our VPs of residence is like one of their first like global surgery fellows. I think like Medical College of Wisconsin, maybe even University of Wisconsin, and there's is it University of Miami, I think also has, or University of Florida definitely has some global surgery faculty as well. So there's a lot. And then I know like schools like Duke and UNC have a lot of strong like global health programs as well. So there's definitely a lot out there. And I think like, as people are going on this interview trail, definitely there are the questions that you've heard everyone on this panel ask, and that'll help you see where programs are at, because they're also changing every year. And adding and strengthening, and it's really awesome to see that like more and more programs are valuing global surgery as like an academic pursuit in line with like being in lab or doing other clinical projects. One of the questions,
clarification to Alyssa's point about Harvard. So there are 3 Harvard programs. So there's Beth Israel, Brigham, and MGH, and they're all separate. And like they don't necessarily all have a formal curriculum for global surgery. So just to point that out.
One question that was asked by a panelist that I thought was really important, something we don't think about, was funding, knowing that research years kind of differ. So maybe starting with Youmna, can you talk a little bit about like the funding that's provided? I think maybe Baylor might be a little bit different because you are in a global surgery track, and so they're expecting you to have travel related expenses and things like that. But how does that look for you?
Yeah, so actually, that was one of the things I was going to suggest the students look at while they're applying. I would look at what your program spends money on, because if it's spending money on something, it's genuinely prioritizing that. So for Baylor, this was kind of a priority from not from the beginning. Rachel had to show that it was a worthwhile, or sorry, Dr. Davis, promise I'll remember to do that. Dr. Davis had to show that it was a worthwhile endeavor. And so her first year, she got all of her funding on her own through applying through grants and through charitable foundations. She actually was able to fund enough to kind of establish a trust for the following global surgery year. But that being said, the entire time, the fact that like Baylor did support the salary, so she didn't have to worry about her salary support for those 2 years. So it's nice with Baylor, and I would look at for any place that you're planning on going to what those research years look like, and if your salary support is there for those 2 years or more or less if you choose to do research or if you do choose to do global surgery. On top of that, all of our expenses for global surgery efforts are covered. So like our flights, our stays, our research for the most part is covered, which has been really nice. That being said, Baylor is very, very proud of like research and grants and funding and stuff like that. So we all still apply for like grants and everything like that. And we've all, I think, received grants over the last 3 years of the program's existence. But it's nice to know that if that doesn't go through, you'll still be able to do all of the work that you were intending to do at the beginning of the year.
Thanks so much. Nicole, I know you've been involved in like 2 different programs essentially during your research years. Could you talk a bit more about like funding with that?
Yeah, so the sort of like general expectation at UCSF is that you will search for your own grants. And while we find that really onerous when you're trying to write all the grant applications as a clinical resident, it actually is an important skill to have, because there comes a time when if this is going to be your career, you do have to write grants and get them. So there's a few opportunities, like the American College of Surgeons has a research fellowship that will cover your salary. The AAS has a global surgery fellowship that I think is like around $10,000. The Society of University Surgeons.
Mm-hmm. It's 30,000 now.
Yeah.
Oh, nice.
Yeah, it's pretty insane. It matches the research one at this point. So,
one, yeah.
Yeah.
It's only for 1 year. It's not 2 years like these, yes. So.
Oh, cool. So yeah, there's a lot of stuff out there, and if those don't come through, there's a number of NIH funding pathways that at least we have access to at UCSF. I would guess that a lot of academic programs are the same. So there's a lot of T32 training grants that are sort of institutions at UCSF and other academic hospitals that trainees can be put onto. So if your research aims sort of fit within that training grant, then you can join that and that will cover your salary. And that's what I did for my first 2 years. And then my work with Lifebox. So if you have some sort of partnership with another organization or institution, they covered all my programmatic costs of, you know, implementation and travel and anything related to do with the Clean Cut program. And then this year I'm doing the Fogarty Fellowship, which is also an opportunity that you guys should look into. And that covers 1 year of your salary and an additional like $15,000 to implement whatever your grant project is. And then I guess the last sort of option is if all of those things fall through, some programs do have dedicated funding to cover the salary of their global surgery residents, which now like UCSF does, I think at least to fund 1 person a year. So you want to make sure that no matter what happens, like someone's gonna pay your rent at the end of the day.
For sure. And should you be thinking about these fundings like at least 1 year to 2 years out from when your research is starting?
Yeah, honestly, I think you want to start like at least preliminarily planning it or like thinking about what you're going to do your intern year, because it just like it takes a long time to get your ducks in a row.
Yeah, so for example, the AAS grant, the deadline for it would to be funded for like your first year of research if you go out your second year is September of your second year. So you would have to have a research project lined up by the end of your intern year, and like a good research project because it's a good grant. You know what I mean? Like,
for sure.
Yeah, it's really challenging to like get all that done while you're also clinical. And it's like in a junior resident clinical where you feel like you're maybe sometimes drowning. So as early as you possibly can, think about it. And it doesn't have to be a perfect project. It just has to be a good project. And you just have to have someone who's a grown up look at it. Like, you know, it just has to be like thought out enough that you can like bring an idea to someone and be like, hey, I'm trying to apply for this grant. It's due this time, like, you know, in 6 months. This is my seed idea. Can you help me work on it? And people are always going to respond well to that. But and then just other things in terms of, I think this is the funding question is just really, really important, because it's true for, even if like, say you're like an M1 on this panel right now, right? And you're like, I don't know, maybe I want to do surgery. Maybe I want to do global health. I don't really know what I want to do. But if you end up doing surgery and decide not to do global health and you want to do academic surgery, it's still just a thing that you should think about asking the question of when you're applying. If your program requires research, then how are they intending to have that be paid for? So, I mean, a lot of people have already talked about like some places cover it. Some people have like have T32s that they put people on. So, and another scheme that my program has is that, and I think this is true for a lot of programs, is that we moonlight for a salary. So you have to have your full license by the time you go out for research. And I have to moonlight a certain number of shifts and I get like a research resident salary for that, or you get like your whatever PGY level salary. But most places do like the NRSA salary, which is like universal across the country. And I have to pay the program back a couple number of shifts. And that's also very important in terms of how you get your benefits. Which is, again, something if you're like, you know, a young, healthy person, you might not think about health insurance, but we live in this country that does not believe in health insurance. So you got to think about it.
For sure. Thank you for providing that advice. I'm sure these are things that, you know, we're not even thinking about yet, and it's important to be considering because it's all important to, you know, overall well-being.
I'm just, paying it back because I didn't think about it.
One of the questions that also came in during registration was around how an MPH might factor in, and if anyone felt that was necessary or not necessary to, you know, becoming a better global surgeon. Rashi, I think you're doing an MPH right now, right?
I am actually not. So
okay.
Yeah, sorry.
But you could, so I know with the program, with the PGSSE, you could have decided to pursue one. Sure. So I guess like, what was your decision in not pursuing that then?
My specific reason was because I have a master's in ethics already, and I just didn't want to pay for it since the PGSSE is an unfunded program. I wasn't interested in also paying for the Harvard School of Public Health. I don't know, but I think it's a great opportunity if you have the means and the desire to do that. I mean, a lot of public health programs will let you do part-time or whatever, and so you can manage the coursework with your clinical or your research work. I chose not to, but I think a lot of, like, at least at most of the Harvard surgery programs, a lot of people do an MPH when they do their research years. Just even, no matter, like, you know, people are doing it who are doing vascular surgery research, people are doing it who are doing endocrine surgery research. It's just like, why not? It's like so cool and great and a great opportunity. So I just personally didn't, because I already have that master's, and I'm going to get my education in those other specific things that I want through other means.
Yeah, I got my MPH a long time ago, right after college. And I would say that considering like the appropriate timing of that education is just as important as getting it at all. Because, you know, trying to recall back what you learned in your MPH degree 10 years later, not super helpful. So I would just, you know, consider that there's opportunities to do it like in med school or in your research time in residency. And there's also, I mean, the most important thing is that you get the skills you need to do the work you want to do. So things like skills in biostatistics or qualitative studies or research design, whatever, are important. You can get those as part of an MPH, or you can get them in like one-off courses or certificate programs. And while it's something that like maybe marginally boosts your CV, I'm not sure that it's super important to have just for the credential reasons.
Yeah, I mean, you're already a doctor. And I think the other part of it is as Nicole was saying, I think it's like super important part is that if you can find like targeted programs to help you get that one skill that you need for whatever it is that you want. Like I'm doing this implementation science course through University of Washington. Actually, it starts next week, and that is something that I specifically want to learn more about. And yeah, I could do it through an MPH, but I can do this too. And we also have like a biostats course and things like that. So if you want to pick and choose your skill sets, then that can get you the same kind of education.
Absolutely. And I know we're kind of coming in on the hour right now, but I did want to ask one more question that we got through registration that might be not something we think about as much, but I know there's locums tenens work that some people get involved in. And so one of the registrants was wondering if that was kind of like a feasible thing for global surgery work. I know a lot of the time we think of global surgery work as much more academic, but you know, this other path exists. So I was wondering, I'm not even sure if actually any of you are interested in that or can speak to that, but if you can, I think it's an interesting path that we don't usually talk about.
I feel like Youmna was maybe the closest to like having a plan for clinical practice.
Sorry, I had a very poor internet connection for a quick second. Do you mind repeating that question?
One of the registrants had asked about the feasibility of locum tenens work in global surgery. And so I was just wondering if anyone had any insight into that.
Gotcha. So to be honest, I think the way that we've set up in terms of our global surgery plan and our plan for our future clinical practice, at least within our group, is that we are essentially the two of us who are first coming off are both planning to go into a situation where we're clinical about 50 to like 70% of the time, and the other 50 to 30% of the time we're spending our time abroad. This is typically housed within an academic institution. And so the idea is that you would find an organization that would allow you to split your timing both between like the academic portion, so like the clinical work, the research work, and your international surgical capacity building work, which works out at least thus far, and those of us who have graduated pretty well, we've been able to negotiate for that time. And so for us, the idea is to do long-term capacity-oriented things. And so I don't know that so much that the locum tenens would necessarily be interesting to us in that sense, because we want to establish like career-long things where we have allocated protected time for our global surgery work. But you know, what a career in global surgery looks like is currently is kind of amorphous. I think a lot of individuals are attempting to define it. There was a great paper written by Sherry Wren at the end of 2019 about what the promotion system should look like within academic global surgery. It's worth a read for those who are interested in it. But I think global surgery as an academic field will be a thing soon. And I think those positions of global surgery program directors will be opening up soon. And so it's one of those things where you can also establish a practice, like a private practice, where you and your correspondents have also pre-agreed that there's a certain amount of time you'll spend abroad. And I think that there is an individual, Operation Giving Back is attempting to create kind of a database of surgical professionals who are looking to partner with other surgical professionals in order to be able to swap out time in their private practice or whatever to be able to do their global surgery work.
Awesome. Thank you so much. I think just to wrap up, kind of wanted to just go through everyone, if there's anything else that you felt like it was, you know, you would have wanted to know as a fourth year medical student applying to general surgery with a global surgery background or interest, what is it that you would have wanted to know? So Alyssa, let's start with you.
Yeah, just a real quick detail to piggyback off what Youmna just said. I was operating with Dr. Ray Price today, which for those of you who don't know him, he's like global surgery giant, brought like laparoscopic surgery to Mongolia, is just like a beast and also super fun in the operating room. But he was telling me he had a meeting, they're like creating a society of global surgery program directors. And so they're actually like formalizing global surgery in academia. And so it's like they're officially voting on committees and stuff. And so that's coming down the pipeline. But as far as applying to general surgery residency, I think I'm just in general going to be better for more like general advice and not global surgery specific. Aside from finding programs, which really is just a lot of investigative work, I would say like make phone calls. So if you're interested in a program and you don't understand there, because a lot of people put global surgery on their website because it's very like in vogue. And then they're, UCSD did this. And then I went there and interviewed and I was like, hey, here are my interests. And they're like, well, we actually don't really have anything for that, but we have a bunch of money if you want support. And I was like, that's great. But it's definitely different than what I would have gone for. So ask questions, but then on top of that, as an East Coaster coming west, I actually wasn't offered a lot of interviews off the bat because people I don't think understood why I would apply so far from home. And so I individually emailed, the reason I actually was accepted to Utah is because I emailed the program director and I said, here's a list of reasons why I feel like I could benefit your program. And he emailed me back and we had like sort of a dialogue and he's like, come interview next week. So just don't be afraid to be aggressive. I think especially during these times where you don't get a lot of FaceTime with people because of COVID, make phone calls, like get your name out there within reason. And then just, that would be probably my biggest piece of advice. I think I got 7 interviews just from sending emails to people and saying like, hey, here are specific things about your program that I really like, and here's why I feel like I'd be a good fit. A lot of that had to do with sub-Is, so I think it's going to look a little different for this generation of applicants. To make myself feel older, I'm not. But good luck, guys. If you're here, you're doing all the right things, and don't stress out too much about it. It's really, you end up where you're meant to be, and it works out really well. So.
Oh, thanks so much, Alyssa. Rashi, you next.
Yeah, I don't know how I'm going to say anything better or different than that. That was awesome. But yeah, I don't know. I like, listen, to be completely honest, I'm from Oregon and I wanted to go back to the West Coast, and I interviewed at a bunch of programs on the West Coast, and I was like very hopeful that I would go home in that general direction. And here I am in Boston, which is not the same. But I will say that I liked the people that I met at BI probably more than I met at a lot of the programs that I like wanted to go to. And so it'll be fine. Like whatever happens is going to be fine. I was very annoyed with everyone who told me that the match works out, because I was like, well, you don't know that. And then it does. So I'm going to be annoying now and say that it'll be fine. And if you, yeah, as Alyssa said, like if you're here, you're already like 15 feet ahead of the game from everyone else. And reach out. If someone is annoyed with you for getting in touch with them, like don't go there. Like, you know, like it's just, we're here to like build each other up. There's like room for everybody. Like this is not a zero-sum game. I'm happy to help out whoever wants help to the best of my ability. And I think that if people don't say that, and people are like kind of weird and like are like bragging about what they've done instead of like listening to what you want to do, then that is maybe a culture that you might, I mean, I don't know, maybe that's you, I don't care. But like for me, that's not the culture I was looking for. And yeah, the culture I think is, everything will fall into place. If you want to make something happen and you're dedicated, people can put you in touch with people. And so that stuff will all work out. It's just, you can't change people's personalities. So you got to look at that. And I think and it'll work out.
Thanks so much, Rashi. Youmna, any final words?
So I'm gonna plug for Baylor, because whoever matches this year is gonna be, I'm gonna be at Global Surgery 7 and you're gonna be at Global Surgery 2, so we'll be working together for that entire year, which like I'm super pumped about. So like please feel free to reach out to me at any point in time.
Awesome, thank you. And Nicole?
So I guess the last plug I'll make is around mentorship. I just want to sort of reiterate like that you shouldn't and you're not ever going to be doing this alone, and having strong mentors who share values with you, who share interests with you, and who want to see you succeed and support you is maybe the most important thing that, you know, I've learned in the last few years. So definitely try to get to know who people are, try to appreciate their experience, even if it's not exactly what you see yourself doing as a global surgery practitioner, and sort of find your tribe, both within your, you know, whatever program you're going to match to, but also in the global surgery community, because it's a big tent and there's, as was said, there's room for all of us. And yeah, you're going to be fine. It's super fun.
Thanks so much. Thank you to all of you for being here. You all have amazing careers already, and you know, I look forward to seeing all the amazing things that you do in the years to come. Just for everyone else who's watching as well, I know there's a ton of things that we didn't hit upon. We've only been here actually just a little bit over an hour, but do feel free to check out the rest of the webinars that GSSA has recorded and posted on our YouTube channel. We have a lot of webinars on global surgery education and research, and also multiple other specialties if you're still exploring what you want to match into, and they're all available for free on the website. So definitely check that out. Never hesitate to also shoot us an email. We're happy to try and plug you in with either residents or faculty. If there's a particular school that you're at or anything they're interested in, we're always happy to connect. We also have a free database on the website as well. It's the GSSA Global Surgery Database. You're welcome to add yourself to that or search through it for other residents and faculty who are also interested in working with students at this time. So if you need anything, we are always here. The email is globalsurgerystudents@gmail.com. It's the same email you got the Zoom link from. So never feel afraid to reach out to us, and good luck for all of those of you who are going through the interview process this year, and hopefully we cross paths soon. So have a good night, everyone.
Thank you so much.